Next is by Dr. Apurva N. A study of workplace injury in eye to eye in a tertiary eye care center.
Good evening, everyone. My topic is on a study of workplace injury to eye in a tertiary eye care center. There is no financial disclosure. Introduction, the work-related injuries or injuries and illnesses resulting from events or exposures occurring in the workplace. The occupational eye injury, it is one of the important cause for preventable vision loss worldwide. The work-related eye injuries hurt workers and their families while imposing a huge burden with respect to manpower and social costs. The objective of the study, it is to study the demographics, mode and type of ophthalmic workplace injury and its management. Coming to the methodology, this is a retrospective study of patients with workplace injury to eye in coming to the tertiary eye care center from January 2022 to August 2023. The source of the study was the outpatient ward and operative records at a tertiary care center. We have included 225 patients, which was a retrospective study. The objective data recorded include the basic demographic information, the mode of injury, the time of injury, then the cause for immediate visual loss and the management. Coming to the results, here 94% were contributed to the males, and when coming to the age distribution, the 41%, that is the highest, coming under the age group of 20 to 30 years. Coming to the mode of injury, the most common in our study, the mode of injury was due to by the wooden stick injury, followed by the iron nail injury. Coming to the visual acuity, when they come to the hospital at the presentation, the two cases were presented with there is no perception of light, and most of the patient had vision around 94 cases and more than 6/12 vision. Coming to the immediate cause of visual loss, which have come to the center, it was 61 cases, around 27%. It was due to the corneal tear, followed by vitreous hemorrhage and traumatic cataract, followed by. Coming to the majority of workplace injuries in our study, it happened during the late afternoon in around 184 cases, around 81%. The most of them are self-inflicted in around 97% of cases, and around 53% were managed with the medical line of treatment. The most common indication among the study population for surgical intervention, it was a corneal tear. And 89% workers did not use the eye protective devices. And coming to the discussion, the majority of workers in our study were adult males belonging to the age group of 20 to 30 years of age. In our study, the wooden stick injuries was the common mode, followed by the iron nail injuries and chemical injuries. And the majority of the workplace injuries happened during the late afternoon. The most of them were self-inflicted, and 89% workers did not use the eye protective devices. And coming to the Chinyalu et al. Reported majority were males with the mean age of 32 years. The most common mode of injury in their study was blunt trauma, and 98% workers did not use eye protective devices, and most injuries occurred in the late afternoon. Then another study by Arunova Kundu et al. Reported the majority are males with age group of 31 to 40 years. The most common injury in this is corneal foreign body, and 88.3% were not using protective devices. The another study by Terence et al. Reported that 88% were males with mean age 31.5 years. The most common injury in this study is corneal foreign body, and only 2.5% reported to having eye protective devices at the time of injury. Coming to the conclusion, the workplace protective gears have to be provided with the regular information, education, and compulsory laws to use them have to be enforced. The most important thing the patients can do to protect vision at work is to always wear appropriate protective eyewear. This can prevent more than 90% of the serious eye injuries. The workers should know the dangers in their working environment, and that is possible by continuous information education at periodic intervals by employing companies or institutions. The employers and employees should recognize the importance of workplace eye safety. Ocular injuries can be reduced by the implementation of appropriate preventive strategies to address each risk factor. These are my references. Thank you.
Thank you. And next I would like to invite Dr. Vatke Vidya Arun Kumar.
Good evening, everyone. No financial disclosures.